I'm Dr. Karen Kelly, a registered nurse and president of the Illinois Nurses Association. I'm proud to introduce INA's video series about the Affordable Care Act, and I'll be calling that the ACA throughout the rest of this video. In this second installment, I'll discuss how the ACA will impact registered nurses. RNs have greater opportunities to contribute to the healthcare delivery that increasingly can focus on wellness and prevention rather than just sick care. The healthcare system has added momentum and incentives to move toward more efficient care models rather than maintain the current fee-for-service reimbursement that pays for volume of services. In upholding most of the ACA, the Supreme Court automatically preserved numerous provisions vigorously pursued by the nursing community. These include incentives for quality innovations to improve patient care and outcomes, and delivery systems that require greater coordination of care, an area in which nurses lead, and strengthen interprofessional team-based care. The ACA improves access to primary care, including improved reimbursement to nurse practitioners, certified nurse midwives, and clinical nurse specialists, as well as wellness and prevention services, and increases funding for nurse-led healthcare centers. Registered nurses can spotlight and replicate their success stories through the Center for Medicare and Medicaid's Innovation, created by the Affordable Care Act and sustained by the Supreme Court decision. This Center for Innovation promotes healthcare transformation by pursuing research and providing grants to develop new ways to pay for and deliver care in methods that both improve the quality of care while lowering its costs. It identifies, develops, supports, and evaluates innovative models of payment and care service delivery for Medicare, Medicaid, and the Children's Health Insurance Program beneficiaries. The Center for Innovation has already provided the first 2 sets of grants to registered nurses and other healthcare professionals and organizations, with more funding available over the next few years. Loan repayment programs are now in place for nurses pursuing the specialty of pediatric mental health nursing. The Nursing Student Loan Program updates student loan amounts, and the Loan Repayment and Scholarship Program is expanded to provide loan repayments for those who serve at least 2 years as a faculty member in an accredited school of nursing. Since the ACA will give access to primary care, many of those who now use the emergency department for basic health care needs will be able to obtain care in clinics and provider practices outside of the emergency department, lessening the load on the nation's emergency departments. This is going to benefit not only the patients seeking care, but the nurses who work in emergency departments and in acute care settings, including ICUs, for example, who see people who don't seek care until they're very ill, sometimes dangerously ill. The third video will talk about how Illinois consumers will benefit from the Affordable Care Act. I'm Dr. Karen Kelly, a registered nurse and president of the Illinois Nurses Association.